Hello, welcome to a webinar from the Independent Pharmacy Cooperative for Illinois independent pharmacy owners regarding the passing of Illinois HB 1697, the Prescription Drug Affordability Act. Today we have John Cavello, the Senior Director of Government Relations with Independent Pharmacy Cooperative, and Garth Reynolds, the Executive Director of the Illinois Pharmacists Association. Today, John and Garth will be discussing the Prescription Drug Affordability Act and what you, as an IPC member in Illinois, need to do to get the benefits from this legislation. Gentlemen, welcome. Thank you for taking the time to discuss this law and how it will affect Illinois pharmacies.
Great. Thank you, Joe. I really appreciate you being able to do this recorded webinar for the benefit of all IPC independent pharmacy store owners in Illinois. As Joe stated, I'm John Cavello, the Senior Government Relations Director for the Independent Pharmacy Cooperative. I work collaboratively with many states across the country in advocating for advancing policies and legislation in states to benefit our independent pharmacy store owners. I am really thrilled that we're able to do this today. I have my colleague and very dear friend as the Executive Director of the Illinois Pharmacists Association, Garth Reynolds, with us. And we're going to be giving you some really important information that will help your bottom line in Illinois for your prescription. So Garth, I really thank you for making the time to do this. I know IPC, as our government relations advocacy team and our communications team, we've been working together almost a decade. And I know we've accomplished a number of things over the years that's culminated in this, but I wanted to give you a chance to introduce yourself to our members before we talk about what's really important legislative advocacy accomplishment that will benefit every independent owner in the state of Illinois. Right. So thank you for joining me today, Garth.
No problem, John. And thank you very much for the opportunity to be with you today to talk about this important piece of legislation. And also to talk about our partnership. You know, as you stated, you know, IPC and the Illinois Pharmacists Association have been working hard for PBM reform for well over a decade, and the fruits of our labor and advocacy are shown, and are moving forward with the culmination of this phase of PBM reform. As I will always say, you know, once we've gotten this done, we still have more work to do, and that's even the case with this.
So Garth, I think it's good to advance, you know, start going through the slides of where we started and how we got here. You know, I know you go back as an association all the way to 2008, but really, I think when we started getting some serious laws on the books, even before Rutledge decision in 2020, and how that kind of, along with COVID, accelerated our abilities to finally get legislators to pass significant policy reforms to PBMs in Illinois.
Yeah, exactly. And a lot of that started with what we'll be talking and coming back to at the core of this discussion today, and that's our critical access care pharmacies. And that program was started back in 2018 and helped establish a dedicated fund of $10 million a year of identified pharmacies, both in rural and in some urban areas, of trying to help supplement some of the losses that we're seeing in these programs as we continue to have these discussions. And we saw that advance with the enhanced professional dispensing fee being added to the contracts in 2019, even though they didn't get enacted until January of 2023. They did get retroed in payments, but legislative wise, the biggest foundation that had to get laid was in 2019 with establishing that we defined PBMs and regulated them, established some base protections. That then continued. Now, granted, COVID kind of had us to hit pause for a little bit, like it did everywhere else, and trying to address these issues. But in that time, we kept talking with legislators, kept advocating, and kept telling our story. And we asked the state to finally do their own homework and look in their own files to see what they could find. And that's what they did with asking the Auditor General in 2022 to do a performance audit. Well, that took a year. And what we saw is $200 million was found and spread over that time.
I see us now at a point that we came out of COVID more cohesive, more coordinated, and a lot more strategic on trying to capitalize on the Rutledge ruling that states could regulate in this area, and the acknowledgement finally from what our members produced in COVID, that pharmacies were critical to community health needs throughout the country, and we're finally waking up to the challenges of it. So,
and I think that also then translated to the movement that we were able to have
yes.
here, because not only, with putting in audit reforms and more transparency, that we got us to the point where we were in 2024,
Right.
but it was also changes in leadership at the Department of Insurance, with Director Gillespie coming in and bringing in all her years of expertise working on the PBM side to saying, we got to pull the curtain back. And then the leadership of Governor Pritzker making this a healthcare priority. That was really the spearhead point that helped drive this forward in 2025.
Well, and Garth, there's an old saying in government and politics, personnel is policy. And the changes of Governor Pritzker coming in, the people he put in his governor's office, including former state senator Menard, who really was a champion in the legislature on these issues, and Director Gillespie coming from the healthcare industry and the insurance industry, understanding what goes on the dynamics that's profit driven. I think Illinois is a model. Why don't we move on to really talking more about this bill, of how this creates this independent pharmacy access preservation program?
Because when you start to really crack the cover on this bill, it is a massive piece of legislation. And the best way to look at it is put it into three different buckets. And that's really trying to look at the business practices and restoring fairness and stopping abuses. But also, as you talked about, we got to look at the data. The department needs to be able to continue to look at that. And so there's enforcement and transparency and accountability. And then finally, which is the main reason for our discussion today, is looking at how there's additional supporting for looking at pharmacy sustainability and preserving patient access, because that's one thing that has been talked about through this entire process, is that we have got to shore up the crumbling foundation that is unfortunately our access system for pharmacy today, and we've got to find ways of being able to correct that and steer that tide of our ever-growing pharmacy deserts.
Yeah. And what I saw coming out of COVID is, and it's culminated this year, is all the closures and even reductions in services that, in Illinois obviously has been seen dramatically by Walgreens closings and CVS. In other states, Rite Aid has totally gone away. I every time I come to a state like yours and we talk to legislators, they're telling us what they're seeing as the impact in their communities and their districts of stores closing. And I think they've even gotten educated. It's not just stores closing where there's deserts. It's also the cutbacks in the drugs they're able to carry and the services providing that, what's now being called by even insurers, keystone pharmacies are left. They're the keystones that are left in communities that we're all trying to preserve. So I think we may end up doing another webinar at some point once we get past January 1 on the enforcement of these other PBM regulations and the ability of Illinois Insurance Department to enforce them, to really talk about the most important thing on this sustainability of the Lifeline Pharmacy, Independent Pharmacy Program for Medicaid that includes both fee-for-service and managed care. But
one thing I do want to point out that kind of hits into what you're setting up is on the banning of spread pricing.
Yes.
One of the very important components of this on the spread pricing also includes that the PBMs cannot reimburse their affiliated pharmacies more than they do anyone else in the network. And so that's a huge component that is going to be a shift of correcting some of these abuses in the lower reimbursements and dispensing fees that you see today.
I think this other slide shows the kinds of aspects of where they're going to have teeth to enforce all this. But this gets, I think, to some of what you may want to talk about. What's really this? You may colloquially call it a lifeline program. I think it's a patient access preservation program for Medicaid. Why don't we kind of walk through what this bill is putting into place starting January?
Right, because we've got a couple different aspects of this. And the very first part of that, you see an annual pharmacy dispensing fee. The state's actually going to be conducting its own study every year. We've proposed that that be done by local experts through our colleges of pharmacy who understand how pharmacy works, how healthcare works in Illinois. And so when those surveys come out, we're going to need you to fill those out. And that's where we've seen challenges in other states where they haven't seen, response rates the highest, and it's negatively having an impact. So once those come out, and we'll be talking more about that as that gets impacted next year and acted next year, and how that goes forward. But that second point right across from it is a huge component. One of the biggest challenges that we have had since the creation of the Medicaid MCO program is that the PBMs and the MCOs have been able to kind of say, we don't have to follow insurance rules because we're under HFS. Correct. Well, this bill removes that fogginess and says the Department of Insurance has overall authority over wherever a PBM is doing business in the state. And so they have to follow the rules, whether they're in an HFS program, whether it's state employee program, they have to follow the insurance code and follow any of the oversight actions by the Department of Insurance.
And that is a very important point you make, Art. Like a number of states, there are about 11 now doing it, where they're applying this to their own state employees' health benefit programs. We've had great success around the country. 33 states now have basically either kept a carve-in of their Medicaid program or gone to cost-based reforms in managed care. Is the realization taxpayer dollars were being abused in this, in the overbilling. But I think you make a very important point. Things like MAC prices, not being able to pay themselves better. Restrictive networks where you are able to fill that prescription before they can't suddenly make it restrictive specialty. Even on the audits, they'll now have teeth on this, not just in commercial, but in the public employee contracts and your Medicaid managed care contracts. So I want everybody to understand this will help your bottom line. But, we're going to keep working on ways that the department's going to provide online tools for you to file complaints. They won't know abuses were happening unless you tell them.
And that's a very important point. And that's where, we've got to continue to work with the department on making sure that we have a complaint process that's actually functional and usable. And because the one we have right now in Illinois does not properly enable pharmacists and or patients to be able to talk about PBM issues that they're experiencing. And that's something that we're working with the department on and showing them best state examples of how that works very well.
And we'll certainly be there to help educate them on what we've worked on in other states and who uses, effective online tools and forms that are PBM complaint specific, so that anybody, patients, pharmacies, or even your PSAO can file these complaints.
Exactly. And that's where we want to be able to work, especially if we can show a lot of these abuses in aggregate. The PSAO is actually going to be a better focus point of being able to help provide that data, and individual stores having to take the time to pull that data together when that can be done more efficiently through the PSAO. I do want to talk about how we're finally correcting the definition of critical access pharmacy.
Yes, let's get into the Medicaid benefits.
Yeah, one of the biggest components here is that over the creation of the program, the original legislative definition only recognized pharmacies that were in counties of 50,000 residents or less. The rules recognized that the pharmacies that were in 50,000 or more that were in medically underserved areas, but that confusion of the both parts being in the legislative definition actually cut out a lot of pharmacies in the 50,000 or more counties from getting access to the enhanced dispensing fees under their contract. And that corrects this with this definition change. And one of the things, so that's really a huge point coming January 1 for those pharmacies in those larger counties that have been part of the critical access program, that have gotten quarterly disbursements before, but haven't been able to take advantage of the enhanced dispensing fee. So that's going to be a huge change come January 1.
So Garth, if I understand this right, the St. Louis metropolitan area, the Springfield area, Peoria, Chicagoland, all the major metropolitan areas in Illinois are finally those pharmacies that thought, well, this program was great, but it never benefited me. this is a major change that they're now going to be able to get into this program. Isn't that correct?
It changes it so that, many of those pharmacies in those areas, and it depends on where their pharmacy location is specifically in that area, if they're within the Medicaid, the medically underserved area,
Right.
or what we've actually seen even in that similar zip code. So that's where, the challenge is. Now, will there still be some locations that may not fit into that area? Yes, but we'll talk about how there's going to be a little bit of a coverage program here to try to fit those pharmacies as well. So what we're seeing,
the CAP program and the support infrastructure, I think this will be important for our members listening of figuring out which bucket they may potentially fall into.
Yeah, and that's where we want to make sure, as we're talking through here, whether it's the program we're talking about today or another application for another program that'll be coming down the road, we don't need you to set on one thing that John and I are going to reiterate between now and the rest of this program is we want you to apply for any and all the programs. We don't want you to set on that, because if you're setting on an opportunity that can help your pharmacy, that doesn't help you and your patients. And we've had pharmacies that have not thought that they qualified, and they qualified the whole time. And we don't want you to miss that. And there's a very small window coming up here that we need you to be able to apply for. But we'll be coming back to that here very shortly.
Yes. So explain the two buckets.
So we have the Critical Access Pharmacy Fund, which had been funded at $10 million. What we saw in the bill, it increases it up to $45 million. We're still working with the department of how all those monies are going to work. We're recording this on October 1. So first, it's American Pharmacist Month. And but we also are in the application window that we'll be talking about here. And there are some definite things that we have to work out logistically with what the department has announced. And we'll be talking more about that in announcements coming both from IPC and IPHA as we go forward. But what we want you to make sure is that you are applying, because for those of you who've been in the critical access program already, you had to attest every quarter.
Right.
That is now changing to an annual period, and that window is open right now.
Right.
And so that we want you to make sure that you're applying. And even if you're a current pharmacy, you need to apply again to make sure that you're attesting for the new program.
So Garth, what I'm hearing you say is if you're in now or you're not, everybody this month needs to get their application.
Absolutely. And it takes just a couple of seconds. So we'll talk more about that. It's very quick. One thing I do want to very briefly touch on, because it's the last component of the bill, and that really focuses on supporting our infrastructure. And it's a new program that's going to be run out of the Department of Commerce and Economic Opportunity, or called DECO. And the part of the bill assesses the PBMs for the covered lives that they utilize in Illinois, and $25 million of those assessed fees are going to be set up for a new umbrella program to try to help fill in, support additional pharmacies as we go forward in these continued discussions. Because as we said, we're not done with PBM reform just because we're here. We are actually working on trying to make sure that we can move and cover those other pharmacies. And so critical access pharmacies also apply here. So do any retail pharmacies that are 10 ownership or less, or, you're in counties of 50,000 or more. We took a lot of the barriers apart, trying to make sure, because we understand in whatever scenario we come up, we're going to have pharmacies that may not fit in the definition. And this program is to try to cover all those situations as we go forward. But I do want to go back.
I think this is important.
Critical
this
access.
Is really important. So this is for everybody that is an independent owner that may not find that they're in an underserved area, didn't meet the other criteria. But I just want to go back to this. If I'm understanding this right, Garth, what the legislature and the governor created was basically a $70 million fund to help preserve the access to community-based independent pharmacies throughout the state of Illinois.
That's correct.
I think that's the important thing. I want our members to walk away with this. This is real money. It's there annually. You're going to have to take some proactive steps to get access to this. But if you have any questions as to whether you don't think this is real, is it something that the MCOs can take away? This is direct state dollars that they put into this fund that is only available for independently owned store or store owners that own 10 or fewer stores. So it is not going to go to CVS. It's not going to go to Walgreens. Correct, Garth? It's going to stay into the community-based owners in the state of Illinois of pharmacies.
John, you just had this slide here on the DECO criteria, and like I said, we tried to work with the state of trying to broaden this definition even more, and it's got a different definition of poverty areas and population density that the state uses in other areas, than looking at just MUAs for the medically underserved areas. So there's a lot different additional criteria that could help with covering pharmacies.
We didn't get every possible conceivable definition, but I think this goes fairly broad that everybody that we're sending this out to as an IPC member in Illinois should feel that this is real and it's something you will most likely qualify for in either bucket. So we just have to help everybody with the proactive steps they need to take.
Right. So again, this is just trying to reorganize the benefits of the Prescription Drug Affordability Act, of trying to help lower costs for our patients, improving access and sustainability, and preserving that access to pharmacies, and just ensuring the oversight, and just trying to bring in a fair competition marketplace, and just pull back the game so that we take care of our communities. And that's what a lot of us went into pharmacy to do, is to take care of our communities. And this bill will help with trying to alleviate those barriers that we've had in the past.
So, Garth, I know there's a process though, and this is probably to me the most important slide of what we're giving today to everybody listening. Okay, what is it that I have to do as a pharmacy owner to be eligible that I will start getting these $15.55 fees?
One that went out with the memo that most of you should have gotten from HFS yesterday in your email, or if you scan this QR code. And I was just looking at the form. It will take you less than a minute to fill this form out. And we just want to make sure that you fill this out, because you have to do that by October 31st. You also see here a new email for questions concerning critical access pharmacies. We've had individual staff members that have been working with answering these questions in the past, and they're probably still going to be doing that, but they've now set up a dedicated email channel, communication channel for critical access pharmacies, so that you see the hfs.criticalaccesspharmacy@illinois.gov. But to submit this form, you don't have to email it. You just have to go on to scan this QR code or hit the link that was in the HFS memo. Again, it takes less than a minute to complete this. And that's a minute to make sure and ensure that your pharmacy is connected for the attestation for next year. Because once you go out this window after October 31st, you won't qualify for 2026. You'll have to wait for the entire year before you will be able to attest again for the program. And we don't want any of you leaving that on the table.
What's the basic information that the store is going to have to provide?
They're just going to have to put in their address, their NPI number, their Illinois Medicaid provider number, the number of locations that they have, and then they have to attest to a couple of different statements before they have to submit it. And like I said, it takes less than a minute to do this.
And I assume those attestations that this information is accurate and truthful. It's nothing really extensive of what they have to do.
No, it doesn't.
Attestation.
Right, and it doesn't require you to have to pull additional data or anything to be able to submit it. It's asking you identification information basically for your pharmacy.
And Garth, is this the form that's going to be used for that infrastructure fund too, or is there a different?
No, that's going to be a different form, and that one is still in development.
If you want to get more money into the store, which we're all working every day to help you do, and we know is reimbursement pains is what all of us in the industry hear from, no matter who they're a member of what organization, about reimbursement. This is important for you to get that $15.55 for each script. So to me, Garth, this is the most important takeaway. If anybody's watching this, or looking at these slides, this slide to me is the most important takeaway.
Yep. Exactly. Don't leave your pharmacy out. Make sure that you can help get these funds to help with keeping your pharmacy sustainable over 2026.
Garth, at this point, do you think there's anything else we need to cover that stores need to know about this?
Not at this point. I think just make sure that you're staying on top of notifications. The only thing I would say is make sure you're staying on top of notifications coming both from IPC or IPHA, and we also think our APA stores as
Yes.
well, is making sure that so you stay abreast of the information as it comes forward, and and we want you to make sure that you're involved with all of us to ensure that we are pushing this advocacy momentum forward. And it is a momentum. And like I said, there are many pieces together that we still need to address. There are a lot of challenges that we still need to overcome, but we are bringing that momentum in a positive way forward. And this bill really helps take us a lot further down the road than we have ever could imagine to be at this point.
Illinois Pharmacists Association has been a great partner coordinating this Illinois Pharmacy Coalition. If you're not a member of Illinois Pharmacists Association, IPC would strongly urge you to consider joining. They're there for you, they're fighting for you, and they're great partners, and they're leading also on a lot of important practice issues that you need to be involved with. They're fighting every day in Springfield. And Garth, I'm just so happy we've had such a productive partnership and collaboration with you. And I thank you for all you've done to work with IPC over the years.
Well, John, and I think you and IPC, with Mark and everyone's help at IPC of being able to help coordinate and bring in that national spotlight and focus and experience that we have to have in those discussions with policymakers of saying, yes, this isn't just an Illinois problem, or this is just a niche issue. This is a large national epidemic issue. And one thing I will add on the membership part is that definitely, call IPHA office if you need to. We can help set up your membership, but also that we have discounted group memberships for your stores to get all of your team the benefits of IPHA. So please take us up on that. And depending on when you hear this recording, join us, at our annual conference in Lombard at October 9th through the 12th. And we'll be glad to see you and help talk to you more about this and other opportunities that are ahead.
Well, that's great, Garth, that they can see the benefit of being an IPC or IPC AAPA member, that they can get a discount on their membership. But I think what this is all showing, there is strength and there is progress from unity in us, in our numbers of us all working together.
Absolutely.
So, Joe, I'm going to turn this back to you. I thank you for the opportunity, everyone listening, for this. Again, get your applications in. There's money on the table for you. I don't want to hear any horror stories of people missing out because they didn't pay attention to this. This is there for you. We fought hard for it. We're going to make sure this works, but do your part. Fill out that application and don't wait till Halloween to do it.
Exactly.
Thank you, Joe.
All right. Thank you, John. Thank you, Garth, so much for all of the information. And again, as John mentioned a few times, we will definitely be sending out the slides. We will be sending out the webinar to everybody. And definitely take the actions needed, and everyone will go forward from there.
Great. Thanks, everyone.
Thank you, Jennifer.
Good day, everyone.